where she is coming from. Okay, Dr. Katz is the immediate past editor of the Oncology Nursing Forum, the premier research journal of the Oncology Nursing Society. She was inducted into the American Academy of Nursing in 2014. She is the author of 14 books for healthcare providers and healthcare consumers on the topics of illness and sexuality, as well as cancer survivorship. Her latest book, the second edition of Women, Cancer, Sex, was published in late 2020, and her latest book about sexuality and illness is being published in later in this year, 2021. So it's with my greatest pleasure that I now turn the meeting over finally to Dr. Katz with her presentation. Thank you.
Okay.
Thank you so much for that introduction. I'm just getting my screen up. Thank you all. Thank you for attending. I know you've all got busy lives as we women do. I'm really happy to be here, and just so lovely to see women from really across the country. So this is wonderful. So yes, thank you very much for the introduction. So these are some of the things that I'm going to be talking about this evening. And I really, really, really want some participation from those of you who are present, because otherwise I'm just going to blabber on for what will seem like hours, and it's not going to be that much fun for you. We can all learn from each other. I've been doing this work with women and men with any kind of cancer, whether they're going through treatment at the time, whether their treatment was a long time ago. And it's just lovely to see women who were treated 30 years ago and are here and vibrant and engaged, as well as people, who are still going through treatment. So we all have different issues when it comes to sexuality. And one thing you have to understand is that I'm just really flat out honest, and I call things what they are. So I don't mess about with, words like intimacy instead of saying sex. So I hope that A, none of you are going to faint, and B, that you will participate and really make this a worthwhile experience for me as well as everybody else who's at this meeting today. So I'm going to be talking about these 5 topics because these tend to be the most common issues that I see in my practice with women who have had breast cancer or gynecologic cancer for that matter. And what I'm going to do is I'm going to address each topic, and then I'm going to open it up for questions or comments, and I'm going to ask the moderators just to keep an eye on the questions because I can't see them right now. So
Okay.
after I've addressed each issue, I will keep quiet, and please feel free to ask your questions, type them in the chat, and then the moderators will, or the facilitators will, read those questions out to me. So it might be a little glitchy in the beginning as we get going, but I think then things will flow better. So changes in body image. This is probably the number one issue that I hear from women certainly with breast cancer, any kind of cancer. I think women have, at times, and not all of us, but women generally have issues with body image, right? We're either too big or too small, too short or too tall. We're too curvy or we're not curvy. We've got big breasts or small breasts. We really don't do ourselves any favor when it comes to body image. So, I see a lot of this. And I've made some mistakes with my patients. So I find that, often when women are feeling uncomfortable with how they look, and this happens particularly after breast cancer, with mastectomy, even with lumpectomy and radiation, because the breasts are altered. So let me tell you the mistake that I made, and I repeat this story quite often just to keep myself humble. So a number of years ago, I saw this lovely woman. She came to see me at my office. She was in her late 40s, French Canadian. She had this lovely sort of French Canadian accent. If any of you've heard it, it's not quite a French accent. It's sort of somewhere in the middle there. And she was dressed really beautifully. She sat down in my office, and I said, "How can I help you?" And she said, "I hate the way I look." And what did I say? I said, "But you look great." Whereupon she burst into tears. So that is precisely the wrong thing to say to a woman who is experiencing, challenges with her body image. What then happened, which was sort of the part that surprised me, other than the fact that I just, honestly been non-therapeutic and not at all helpful, she lifted up her top. She was wearing a blouse and a skirt. She lifted up her top. Now, people don't get naked in my office. I don't even, I wait till I get to the gym to undress. I certainly don't do it in my office. Anyway, she lifted up her top. And do you think I didn't make it worse? I said, "Oh, you have Barbie breasts," and promptly wanted a hole to open in the floor so that I could disappear. I could not believe how badly I was handling this interaction with this lovely, lovely woman who certainly didn't ask for my bumbling and stumbling. So she started to cry, and people do cry in my office, and I apologized for what I said. And I explained my comment, sort of trying to dig myself out of that hole, because she'd had a double mastectomy, she'd had reconstruction. She was a thin woman, so they couldn't use her own tissue to do the reconstruction. So she had saline implants, and she had these perky breasts that did not have areolae, which is the colored part, depending on your skin tone, obviously, but generally it's a deeper color than the rest of your skin, around the actual nipple. So the nipple is the sticky uppy part, and then the areola is the part around it. And if any of you recall seeing a Barbie, that's what Barbie breasts look like. They are perky. There's no
Excuse me.
nipple or areola.
Excuse
And
me, Dr. Katz, would you
yes,
speak a little bit closer to the microphone? Some people are having a hard time hearing you.
okay, I'll try.
Thank you.
I'm about 6 inches from it, so you're seeing a lot of me.
Okay,
Um,
thank you.
so 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 when we talked after she stopped crying and I stopped crawling out of the hole I had dug for myself, we talked about the fact that her breasts no longer reflected her age, because women in their late 40s generally do not have natural breasts that, are that of an 18 or 19-year-old. And well, I must have apologized about 22 times. And then we had a really good discussion about what her feelings were. She was really reluctant to talk to the plastic surgeon about how she felt, because she didn't want him to feel that he hadn't done a good job. And I see a lot of this. People, particularly women, not wanting to really address their dissatisfaction with someone who had saved their life. And so, I think that this is not necessarily a good thing for the plastic surgeons either, because they need to get honest feedback about what they have done. And yes, most of them think that they are artists, and they will tweak and constantly revise scars and all that kind of stuff. And they'll really do it as often as they think the woman can bear it. I'm not sure that that is always a great idea. So, certainly that is an issue with body image. Weight gain is another big issue for women, particularly women post-menopause, or women who have gone through what we call a chemical menopause because they've had chemotherapy. And often that weight gain is around their middle, that spare tire weight gain, which honestly doesn't budge. You can exercise constantly, you can alter your diet, deprive yourself of the food that we love and that sustains us and enriches our life, and that spare tire does not budge. No one's really clear why that happens. I have a theory that it's actually about our bodies needing estrogen. So after menopause, when the ovaries are no longer producing estrogen, uh, our body needs that estrogen for our brain, for our heart, to make us, because the body wants to be in balance as it was premenopausally, and we produce estrogen in our fat cells. So that is my understanding. I may not be 100% right, but this is why women will often gain weight after menopause, because our fat cells are going to produce that estrogen. Um, Certainly for some women, weight loss, particularly women who've gone through chemotherapy and perhaps have had some nausea and vomiting, even though really today that shouldn't be happening. We've got really, really good medication to control that. But women who have lost weight may be dissatisfied with their body image. And a lot of this is because society, the media, tells us that we have to look a certain way. And I know that certainly for Latina women, this body changes, the research tells us these body changes are quite distressing. There is research that suggests there's a lot of fear among Latina women after breast cancer that their husband or partner is going to leave them. And all of this, our culture, our religion, our beliefs, play into how we see ourselves and whether we see ourselves as attractive or not. And women spend a lot of time being really, really harsh to themselves. I think we're harsher to ourselves than we ever would be to another woman. And so I think sometimes, you've got to have a little chat to yourself. And this is where self-compassion comes into it. And self compassion is not just something that springs into your head, it's really a process that we should go through where we are unkind to ourselves and we judge ourselves so harshly. And really, accept our body for what it is. To have gone through treatment for breast cancer or any other cancer takes an enormous amount of strength, physical strength, as well as emotional and psychological strength. So we really do need to be kinder to ourselves. And sometimes we actually have to do that in a conscious process. So when you start beating yourself up about things, and give yourself a good old slap on the wrist and remind yourself that your body, gets you through each day and gets you through the things that you have to do, and how often we push ourselves to do more and be more for the people that we love, and we neglect ourselves. So self-compassion can really be helpful when one is experiencing, just really being down on oneself. There is a huge body of literature now, and we know that mindfulness is really, really helpful for all kinds of things related to changes after cancer treatment. So mindfulness actually comes from the from Buddhist beginnings, but it is not a religion. It doesn't replace any religious beliefs that you have. It is a way of being present in the moment in a non judgmental way. So it really does link into self compassion. Mindfulness is a practice. It's not something that, suddenly one day you're mindful. You have to really, really practice it. I try every day to be mindful. I try every day to carve some time out of myself to just be still and meditate. And I know for a lot of people that sounds kind of woo woo, but it's just a matter of me sitting quietly, no music, my phone turned off. And just I do it through the breath, through breathing, and certainly thoughts will enter my head. Like, I am bored. When is this going to be over? Or do I really have time for this? Because I've got all this other stuff to do. Or what do I have to do on my way home from work? And the trick with mindfulness, or the practice of mindfulness, is actually just accepting those thoughts and letting them go, like clouds in the sky. And we can do the same thing when we are feeling bad about our body, about how we look, about all kinds of things. So we know that mindfulness can be very, very helpful here. And the other thing, and you're going to hear this over and over and over again, the other thing is to communicate with our partner, if we have a partner, about the way we are feeling. So I see women all the time who are dressing and undressing in the bathroom, in the closet, with the door closed. They never ever undress in front of their partner because they are ashamed of what their body looks like, afraid of being judged, a whole host of fears and anxiety. And when we do not undress in front of our partner, we deprive our partner of an important sensual experience. So, not infrequently, I have had a couple in my office, and I really do try to see couples, because when there's a sexual problem and the woman is part of a couple, she is not going to fix this by herself. Her partner needs to be involved in the counseling, in the therapy, in finding the resolution or solution for what is going on. So I've not infrequently had a couple in my office, and at some point the woman turns to her partner and says, "How can you possibly want me? Look at me. I am damaged, right? I have a breast missing, or I've got a big lump taken out of my breast because I had a lumpectomy, or my skin is thin and burned because I had radiation therapy." And very often, when the partner is a man, he sits in my office and he looks like a deer caught in the headlights. He doesn't know how to answer that question. It's kind of like, do I look fat in these jeans? Very difficult to answer that question because you're probably not going to get it right. And so what I tend to do, because at that point emotions are really running quite high, and I really want to spare this poor man putting his foot in his mouth, I say, let's stop a minute and let's look at him. Does he still look the same as he did 10, 20, 30 years ago? And we all laugh because we change over time. We look different over time. But when you're in a good relationship, you love the essence of your partner, not the outside. So I don't know if any of you who are partnered with men recognize that, over time they get that little kind of pot belly in the front and their butt completely disappears. I'm not quite sure why that happens, and their pants start to kind of sag. Um, so, we change over time, but that does not mean necessarily that our partner loves us any less. So, talking about how you feel, I'm embarrassed to undress in front of you. I'm scared that you will judge me. I'm scared that you will reject me. Not an easy conversation to have, but if you don't have that conversation, the two of you are going to be in parallel paths. Probably for the rest of both of your lives, and there will be misunderstanding and assumptions that are often wrong, and eventually distancing because of that lack of communication. So I am now going to keep quiet for a little bit and see if anybody has comments or questions. I've just opened my chat, so if nobody is if you're not looking, so do one of the facilitators want to read this, or do you want me to read it?
Yes, I have. Can you read it?
Yeah, sure.
Okay, because there was, excuse me, Dr. Katz, there was one before this one. So after you do this one, I'll do the other one. Okay.
Okay, I just see one from Gethsemane, which is such a lovely name. I've never
Okay, no, I have two others. So
okay, and then I've got Gethsemane, I've got Naomi, and I've got Christine. Do you have others?
Do you have Lopez?
That's Gethsemane Lopez, yes.
Okay, yes. Then you have them. Good. Okay. Go ahead.
So Gethsemane. I remember everyone around me was shocked that I didn't lose any weight. Instead, I put on a lot of weight, even on my face, with lots of the cortisone they gave me, the surgeries, and the chemo. Absolutely, Gethsemane. You can put on weight anywhere. When I put on weight, I think one of the first things is I get this round face, and I'm not happy. I have struggled with my weight my whole life. I've lost the same 65 pounds now 6 times, and I beat myself up a lot about it. And And yeah, you don't necessarily lose weight when you have cancer. I think, generally people have this idea that somebody with cancer is, very, very thin and very, very frail. But, for many of us, particularly women, and with cancers that are often hormonal, we will actually put on weight. So thank you for sharing that. So here's Naomi. I've been in menopause for 10 years when I had my hysterotomy, and I easily gained 50 pounds and have struggled to keep it down. Now that I've started my hormone meds for cancer, I'm afraid of gaining more weight. Exercise, diets, and starvation do not help, but I feel like it's a never ending battle. And then there are two sad faces. Yeah, Naomi, it really, really is. And I think what a lot of us do when we gain weight is, first of all, we're really mean to to ourselves, and that often will lead to overeating, binge eating, which really doesn't help. And honestly, society has told us that there's this standard of beauty. And one of the things that I really admire among African American women is this acceptance for many of them for being bigger, for not looking like, one of those supermodels who probably has been eating lettuce for the last 15 years. That body acceptance is so, so important, but so difficult. So here's from somebody. What about if you're 30ish and single? I'm coming to the single women. I'm getting to the single women because this is really, really important. So, can we possibly be at peace with a new normal compared to my peers, especially? Yeah, it's really, really difficult for single women. I'm going to talk about that at the end when I talk about disclosure. Um, but certainly I think this just adds another layer of complexity or another challenge, where society tells us we have to look a certain way. It's not about who we are or what we can do, it's what we look like. And it's something I certainly fight about. So Christine, was that her comment no was also about the weight gain with menopause? Yeah, not helpful. um, Tamika, can I get you just in a second? Sheena, the crazy cycle of shame. Yeah, it's um, we are shamed, and I think we feel shame and we feel guilt, even though there's nothing that we could have done to change getting cancer, to change having the treatments that are often so difficult. It's we have to let go of so much, and I think one of the things really is shame, another is guilt, and perhaps another is just trying to force your body to be something that it doesn't want to be. So Laura has a question about orgasm. So I'm one of the topics that I'm going to talk about is changes in orgasm. So Laura, I'm going to deal with that in a couple of slides. Gethsemane. One of my biggest insecurities is to show my naked body again to my husband. I know he loves me very much, but I'm afraid that he may unconsciously compare me with my own prior body, let alone with other women. Yeah, this is something that you need to talk to him about, because if you are having these thoughts, it's really going to impact on your relationship with your partner. That becomes the 300-pound gorilla in the room. He's probably aware that you're holding back in some way. He's certainly aware that you're no longer acting the way you did with him in those private moments. And as I said earlier, for some reason, and it's something that really boggles my mind, is that men are much more, not all men, but men are much more accepting of their body. I can tell you that I often catch my husband checking himself out in the bathroom mirror after his shower. I try not to put in my contact lenses so that I don't have to look at my naked body. What is that? He accepts me. He loves me for who I am. He keeps telling me that, and we've been together for 44 years. And yes, I was 10 when we got together. No, just kidding. I'm actually older than I look. People tell me. And he has no shame. He'll walk around the house completely naked. It sometimes drives me nuts. But I would never, ever, ever do that. Whether I'm heavy or I'm thin, it doesn't matter. Even when I'm at what I like to be my ideal weight, I'm embarrassed by loose skin. I mean, I really don't give myself a break. So, I'm there with you. Um, so somebody else asked about Sina. You asked about reconstruction and dating. I'm going to get to that as well. So just give me a little. Um, give me a little bit of time. I'm going to talk about. Hang on a second. I just want to make basically. No, I'm going to talk about it now. So for some of us, or for many of us, I don't know what the qualifier there is. Our breasts are an important part of our sexual response. That is called breast sensuality, right? So, for some women, for example, breast play can be a trigger for orgasm. It's often a trigger for arousal or really increases arousal for women. And unfortunately, in the chaos and the trauma of a breast cancer diagnosis, women don't realize, for example, that by having a double mastectomy, so removing the other healthy breast, and women do this for a whole variety of reasons, but by doing that, they are going to alter or diminish or decrease or obliterate that breast sensuality. This is something that people like me are talking to breast surgeons and plastic surgeons about, to try and get them to recognize that this is something that we need to be talking to women when they're going through that decision making process. So if a woman has cancer in one breast and she's speaking to the surgeon and she says, just take them both off because I never want to have to deal with this again. I want to live. I want to be there for my children's graduation, and for when they have their own children and I'm a grandmother. So they're making a decision out of a great deal of duress, right? Because survival is so important, and the diagnosis is an absolute threat to survival. So women will often, just not recognize, not even think about the role that their breasts play. So, um, so yes, it's you know, by having a bilateral mastectomy, the reconstructed breasts don't often look like your natural breast. Now, sometimes they can look better, and I know for some women who are heavy breasted, they really like having, smaller breasts after reconstruction, or vice versa. Um, but this image, this the body image issues related to reconstruction are really quite significant. Yosemite, yep, your husband is confident. I hear you, lady. Um, so so from somebody else, it's also true if you don't tell men, they don't even notice, because two have been face to face with a reconstructed breast and had no idea it was fake and had to yeah, listen, you can, I always tell my patients, the women that I see, that when men are full of lust, it's like they have blinkers on. They honestly don't see anything. They just want to get it on. um, Certainly, tattooing is amazing to really help women accept their reconstructed breasts. And if you can find a tattoo artist who can do 3D tattoo, nobody can tell that the areola in particular are tattooed. Um, yeah, I think many of us take a lot of our body for granted, and it's only after well, and isn't this a metaphor for life, right? You only notice how much you miss things when they're gone. And yeah, many of us really do not recognize the important role that our breasts play. I think for many women, our breasts are our outside sign of femininity. Um, and um, and yeah, it's really a loss. So, all kinds of issues here, and I do want to, I really appreciate these comments, but I want to move along because I'm afraid we won't have enough time. Um, so somebody had 3D tattoos, and then she lost them after her implants were removed and she had reconstruction. Yeah, and then you land up with even more scars, and scar tissue doesn't react the way that normal tissue does. Um, Oh yeah, Tamika. I'm sorry. Yeah, so Tamika's gained weight, and the plastic surgeons don't want to do anything until she loses weight, and it's just so hard to get rid of that weight. And I think yeah, first of all, BMI is a terrible, terrible measure of anything. There's lots of talk now about disregarding the BMI because it's really based on weight, and our weight is not an accurate measure of what our body really is, right? So we may weigh more because we've got more muscle. And that really puts the whole BMI thing out. So, Tamika, keep working out, right? Because your heart is very, very important. And heart disease is common in women after menopause. And I think many women think that the greatest risk to our health is from cancer. It's actually from heart disease. So you got to keep your heart healthy, keep working out, eat healthily. Don't deny yourself, healthy, good food, because that really fills our soul, and that's so important, right? We're so much more than our body. So, okay, everyone, I'm going to move on to the next topic, and then there'll be time for comments, I hope, for comments and questions at the end. Okay, if I had a quota for every woman who told me that they don't feel desire anymore, I would have a lot of quarters. Women tell me this in the line at the grocery store. I have no idea why. My husband tells me I've got something on my forehead that says to people, talk to me about your sex life, and then they just talk to me. Um, Many years ago, we live in a condo, and when we first moved into the condo building, the first summer we were here, some of the people organized this like a potluck on in the social part of the building, and there were icebreakers, and one of the icebreakers was you had to write down what work you did. So you had to put down your name and what work you did. And that's what I did. I put down my name and said I was a sexuality counselor. And honest to goodness, I had 6 men following behind me the whole night. And I was not eager to talk to them about that, I can promise you. Anyway, so people talk to me about this all the time. My friends talk to me about this, my female relatives talk to me about this, my students talk to me about it, my colleagues at work talk to me about it. And this loss of desire is something really, really interesting. So for many of us, our understanding of the a woman's sexual response is that we first have to feel desire, and then we can make something happen, then we can get something going. This is a very male model of sexual response. Um, you know, Firstly, men recognize, right, when they are aroused, and men think about sex a lot. I know I'm generalizing here, but, they do. We've got other things to think about, right? The laundry, the shopping, the work, the children, etc., etc., etc. Men, pretty much sex. I'm joking, and I hope my husband can't hear me because he might disagree. Um, so, if you wait for your desire to kick in, ladies, you're going to be waiting around for a long time. Because for women, our desire is often reactive. What do I mean by this? So, just bear with me with this one. This is a model of what is called the responsive or reactive desire model. So, if you're in a relationship, go start at the top left hand corner. If you're in a relationship that is good, there is caring, there is love, it is not fueled by alcohol or abuse. And if sexual stimuli happen within an appropriate context, what do I mean by that? If I'm unloading the dishwasher, I don't want anybody to interrupt me, least of all my husband who wants to get busy. So that would be an inappropriate context. This also means that the kind of touch that the other person is giving you is something that you enjoy, that is appropriate. So, some women do feel this spontaneous desire. I'm not suggesting that nobody has this, but they say that about 75% of women actually have reactive desire or responsive desire rather than um, spontaneous desire. But spontaneous desire certainly exists. So, if you're in a relationship where you're willing to be receptive, sexual stimuli happen within the appropriate context. Generally, that is where we kind of go through the subconscious process of, you know, do I have enough time? Is there something else I have to do? Did he just piss me off by doing something that I didn't want or didn't appreciate? So you go through that process. And that is often where you experience that feeling of arousal. For some of us, it's a tingling in the genitals. For some of us, it's more mental. When you recognize that you're turned on, generally this is where sexual desire kicks in. So this is responsive or reactive desire. The model goes on to say that for some women, many women, we don't need orgasms to be sexually satisfied, but that satisfaction leads into increased motivation for the next time. The model also recognizes that for many of us, we are sexual for non-sexual reasons, to feel connected to our partner, for our own sense of well-being, to stop our partner from vibrating. So there are multiple reasons why women either initiate or are accepting of um, that that sexual initiation. Um, so I think if it's just really important to recognize that sometimes when you get things going with your partner, what I call kissing and canoodling, that is often where you start to feel desire. Of course, you have to be in a relationship where you can say no without negative consequences. That's really important. I was very sexual before cancer, chemo, radiation, bilateral mastectomy, and thyroid surgery. Now I'm not so interested in sex and can't even get wet. So, yeah, so lubrication is dependent on estrogen. Estrogen is the hormone of arousal. And estrogen, and I'm going to talk in a little bit about pain, sexual pain. For women after breast cancer, it's directly related to that lack of estrogen. And if something hurts, why are you going to want it? Listen, that said, there certainly are some people who are into pain with sex. We'll talk about that in a little while. It's not generally, a lot of people. It's kind of a small piece of the population. But yeah, so that lack of arousal, and that lack of lubrication makes sex painful. Tamika, you've been through a lot. I mean, they've really thrown everything at you. And remember also that, how you feel about yourself can also play into this. If you don't feel desirable, that can certainly interfere. The mind is extremely powerful. And it affect, that mind body connection is very real. So remember that as well. Sometimes you really got to do a whole bunch of mental work to really get in the mood. And it's important to tell your partner that, that the initiation needs to start early in the day with your partner, saying things to you, saying thank you, appreciating you, treating you with love, right? Taking out the garbage without being asked. All of those things can really help you get in the mood. So I'm just looking at the time. We're almost approaching an hour here. So anybody have anything else to say here? Do you want to type something in, or shall we just move on and leave that for questions? What do you think, facilitators? You're you're muted. Rita? Okay. I'm gonna
We can
move
move on.
I think we should move on and just
Yes.
wait, yeah, because
Okay.
we want to get as much in as we possibly can.
You got
Yes.
it. Okay. Pain with sexual touch. So, this is another conversation that I have a lot of time, that women say to me, not only are they not lubricated, but any kind of sexual touch hurts. So, I every talk I give, and I give a lot of talks to oncology care providers, nurses, oncologists, social workers, etc., I always talk about the vulva, because generally people talk about the vagina and they don't talk about the vulva, and they regard everything down there as the vagina. The vagina is the inside part of our sexual organs. It's a self-cleaning organ. That's why douching is not good, because you alter the balance of everything in the vagina. So, honestly, nothing should be going up there. Not Diet Coke, not Dr. Pepper, not Summer Breeze. Your genitals are not supposed to smell like perfume. There is a natural odor, which is important because that can serve as a source of arousal for our partner. So, no sprays. And I am just horrified at what I see when I go into the drugstore, because honestly, we should not smell like summer rain. We're not meant to. So I digress a little bit. Anyway, so when I see women who say to me, I'm dry down there, or I'm experiencing pain down there, that doesn't tell me a lot. So what I generally say to them at that point is, down there is like Australia. It's a very, very big part of you. And in order to help you, I need to know if the problem's in Sydney or the problem's in Melbourne, because they're about 700 miles apart. So we need to get really down to the nitty gritty. You need to tell me exactly where it hurts. So if you are looking at the vagina, right? Imagine the vagina is like the face of a clock. Between 5 o'clock and 7 o'clock, so at that bottom part of the entrance to the vagina, that area is exquisitely sensitive to loss of estrogen. So for many women, any kind of touch there or attempt at penetration with a sex toy, a finger, or an erect penis, it is going to hurt like the dickens. It's going to sting, it's going to burn, and your body is going to do what it's meant to do. It is going to tighten up the muscles of your pelvic floor because it does not want anything to come inside. Right? That's what the body does. It protects us from pain. You put your finger in the flame of a candle, you're going to pull your finger away pretty darn quick. So, what happens with pain with sexual touch, and for some women, when the vulva is dry, and this happens particularly for women who are on the aromatase inhibitors. So I heard from some of you that you're on tamoxifen. So generally we give tamoxifen to women who are premenopausal at the time of diagnosis, and then we switch them after 5 years to an aromatase inhibitor. So these are things like letrozole and exemestane. Those are the names of the aromatase inhibitors, and the aromatase inhibitors take away any little bit of estrogen that is in your body. So estrogen is produced by the ovaries and also the adrenal glands, which are little glands that sit on top of your kidneys, and as I said, in our fat cells, and our bodies really long for that estrogen. So the aromatase inhibitors take away all that production of estrogen, and this results in a dry vulva, and for some women also in a dry vagina. And so I ask these kinds of questions of the women that I see, because if I just start talking about, for example, lubricants, right, and moisturizers for the vagina, I may miss the fact that she has pain on the outside, that when she pees, it stings, right, because those tissues are so dry. And certainly post-menopause, most women, even without breast cancer, experience vulvovaginal dryness, but especially if you've been treated for cancer. So what are some of the things that we can do for this? First of all, you got to take a long time making sure that you are adequately aroused. And that may involve using a vibrator, And I cannot speak highly enough about vibrators, because what vibrators do is they provide stimulation that is way more intense than you or your partner can produce. So it saves a whole lot of energy, right? And hand cramps. So a vibrator, there are many, many, many available. Some women are reluctant to use it. They think their partner's going to get angry because they're being replaced. This is really energy saving for the partner. You know, you can certainly experiment with it alone to figure out where it works for you, but bring it into sex play with your partner. That is the best way to explain to him or her that this is not a replacement, this is an enhancement. So, use whatever you have to help with arousal, because that lubrication will help to reduce the pain. Lubricate, lubricate, lubricant. Get a decent lubricant. For those of you who have a bottle of KY jelly in your bedstand or in the bathroom, it needs to go into the garbage. KY jelly is your mother or your, I see somebody's applauding me there. KY jelly is your mother or your grandmother's lubricant. There are way better lubricants available today. Basically, lubricants um, come in three categories. Oil-based lubricants, not a good idea. You should not put any kind of oil or let any kind of oil go into the vagina, because it's going to alter that delicate balance, that natural delicate balance in the vagina, and you can land up with infections or inflammation. Just, no oil, not even coconut oil, please. Coconut oil is okay on the outside for daily comfort, but you should not be using Crisco, butter, margarine, olive oil, shea butter, you name it. Any kind of oil should not go into the vagina. Then there are water-based lubricants. Those are good entry-level lubricants. KY jelly is a water-based lubricant, but it's also got a lot of additives. It's got propylene glycol as a preservative. That's antifreeze. It's got glucose to make it not taste terrible. Glucose can, for some women, really cause yeast infections or make them worse. So there are other water-based lubricants, and if people want, you can email me and I'll send you, I have a handout. I will send you the handout that has pictures of good lubricants on it. And then silicone-based lubricants. Silicone-based lubricants are the best that you can get. This is not dangerous silicones, and I know a lot of women who've had breast cancer are sensitive about the whole silicone issue. This is medical grade silicone. It sits on the tissues. It is not absorbed. It stays slippery for a really long time. If you drop some on the bathroom floor and you or your partner stand on it, you're going to have a broken leg or a broken hip, and you're not going to be having sex for 3 months anyway. So certainly there are a number of silicone-based lubricants out there that are really good. So, for what they call foreplay, and I try not to use the word foreplay because I think it suggests that something's coming after. And for some women, penetration is not possible, and they do all other things, right? The stuff that we did when we were teenagers, where we weren't having sexual intercourse. So I hesitate to use that word. But for any kind of vulvar touch, you put some lube there, because it'll really cushion things and prevent that friction, which is painful. Mindfulness can also help with pain in terms of, just being in the moment, being present, recognizing when things perhaps don't feel comfortable and stopping the activity, moving your partner's hand away, being gentle about it is important. And the other thing is that there are, I always tell my patients, there are many other ways to skin the cat, right? And I shouldn't say that, because those PETA folk are going to get after me, because you shouldn't be talking about skinning cats. It's cruel too, and I love cats. There are, you don't have to have penis in vagina sex if you don't want to have. Most women are orgasmic with clitoral stimulation rather than with penetration, so you need to experiment and see what feels good. So I'm just going to go to the chat now. So thank you, Gethsemane, once again. Yeah, so Gethsemane says that her post-treatment body is just not in sync with her partner. Um, and he has his own health issues. Yeah, absolutely. So, that is extremely common. And what I sometimes see with couples where the woman experiences sexual pain and then just grits her teeth to get through it, what we often see there is that the partner develops their own sexual problems. So in men, we see men develop rapid ejaculation or premature ejaculation because he knows that she's in pain and now he just wants to get it over and done with, and he feels guilty and he feels terrible, for asking her to do this. And we also see men develop erectile dysfunction for the same reasons, feeling guilty about this, feeling guilty for his desire for her. Um, and that is problematic. So Laura, yeah, you know what, I will actually send that pamphlet about the handout about lubricants. I'll send it to oh my god, I've just forgotten your name, I'm so sorry.
Gwen or Rita?
No, I don't have your email. Who organized this? Who've I been in contact with?
Yes, Stephanie. I can email you after, and we can send it
Sorry.
to all the registrants.
Sorry, I just forgot your name and I didn't want to
It's okay.
say your name, so now I'm blushing. Okay, so I will send it to you. I'm just looking at the time. I'm going to move along. Somebody asked about orgasms. For some of us, it's easy to have an orgasm. For other of us, we just keep trying and trying and trying. So, certainly, after menopause, orgasms can change, and this is directly related to the muscles of the pelvic floor. A lot of the sensation of orgasm comes from contraction of the muscles of the pelvic floor, which lie in a sling from your pubic bone at the front to your tailbone at the back. The vagina goes through the muscles of the pelvic floor, the urethra, the tube that you pee out of, as well as the rectum goes through the muscles of the pelvic floor. And one of the things that happens after menopause, or surgical or chemical or natural menopause, is that the estrogen estrogen helps to support those muscles much the same way as it does to support our skin. It's through the production of collagen. So some women after menopause get a lot of urinary tract infections. That's directly related to that loss of collagen. That's why we get wrinkles, right? It's that collagen matrix, that collagen, almost like fabric that holds things up, is dependent on estrogen. So what we will often see here is after natural or treatment-related menopause, the muscles of the pelvic floor don't react to the sensation of sexual stimulation the same way. So we kind of have orgasms that just kind of don't work all that well. Also, this is related to how we feel about ourselves, how we see about ourselves. If you're having sexual pain and things are rushed, you are not likely to have orgasms. After menopause, we know that women need more direct stimulation and more intense stimulation. So once again, this is why you need to get yourself a handy dandy vibrator. And I actually have a handout about vibrators as well, which I will send to Stephanie. Many women don't like going into a sex store, and there's a company that has really nice vibrators that I talk about in that handout. So I'll send that to you as well. So you need to take your time. You need proper stimulation that feels good to you. And go and see a pelvic floor physiotherapist if you're having problems with bladder leakage, if you're having problems with constipation or diarrhea or just irregular bowel movements. Often it's because there's something going on in your pelvic floor, and the pelvic floor physiotherapist will assess the muscles of your pelvic floor. It's an internal examination, certainly not high on my list of things to do, but they can really, really help. And there's the American Society of Physiotherapists. They have a section on their website that you can find a pelvic floor physiotherapist where you live. And honestly, it's so helpful, because do you remember Kegel's exercises that you were told to do after you've had a baby? Most of us do them wrong. Many of us, particularly if you exercise a lot, actually have a really tight pelvic floor. And if you do pelvic floor exercises, you can actually land up making things worse. So you don't want to over extend those exercises if your pelvic floor is already tight, and you may not know that it's tight. So please think about seeing a pelvic floor physiotherapist. They can be really, really helpful. They can also be really helpful for women who are experiencing sexual pain with any kind of sexual touch or attempted penetration, right? Because when those muscles close up, sometimes you can actually get trigger points. So you get this hypertonic, so this very, very tight pelvic floor, and sometimes you get trigger points, like you do in your shoulders, back, and neck. And the pelvic floor physiotherapist can teach you how to massage those out yourself. So really, really important. So here is a question. My partner tells me he feels anxiety. However, he does a lot of playful talk throughout the day, which helps us both. Absolutely. Wouldn't this be great if we all did this and our partners did it? It's that wooing, right? That verbal communication of desire and interest that can really get you going. Okay. Let me move on, because it's 9 minutes past the hour, and I know we've got other stuff that we'll talk about when the recording is off. So, I want to talk about the issues for single and fabulous women. How do you tell somebody that you've had cancer, that you have a breast missing, or you have 2 reconstructed breasts, or your breasts don't respond the way they used to, or you've gained weight, or you've got stretch marks, or you're really skinny, right? It's so difficult. I speak to a lot of adolescents and young adults who've gone through cancer, and if you can imagine, for many of them, they really don't have any experience dating, and that's one of the developmental milestones that you have to work through as you become an adult, is experimentation, sexual experimentation, figuring out who you're attracted to. And it's so difficult to tell a prospective partner that there are these physical changes, or that you just don't respond the same way. So one of the things that really you have to do is pluck up the courage to actually dip your toe in those waters. And yes, you are going to be rejected, but you may not be rejected, and often it's not because you've had cancer. You are rejected because there just isn't any chemistry, or you don't really click. And it's really important to put yourself first. Don't blame yourself for someone not calling you for a second date, or for someone ghosting you. Often the issue is with them, not with you. So I think that this whole online dating thing is actually a potential gift for single people, because it allows a little bit of distance. It allows you to have some conversations before you meet that person in person, face to face. So if someone doesn't, if you don't connect with them again, it allows a little bit of a buffer, and perhaps keeps your self-image or your self-esteem a little bit more intact than if you had met somebody for coffee and they'd done a Joey. If those of you who remember the TV program Friends, one day Joey goes on a date, I don't know, he meets a girl somewhere, and things are just not going well, and he excuses himself and he goes to the restroom and he climbs out the restroom window. That's doing a Joey. I hate to think that that's what people do, but yeah, people do silly things. So online dating can be really helpful to just kind of check people out, see if this person is interesting. Are you interested in seeing them again? Don't sell yourself short. If you don't sort of feel a connection, or even if someone is not physically appealing, and hey, we judge people too, right? As much as we are judged. Remember, the photographs are probably not real. So somebody may, show themselves to have gorgeous locks. And when you meet them in person, well, they're kind of balding. But remember, you people are people, and you don't want to necessarily judge them harshly, because that's not something that we like. So online dating, is, I think, a good thing. Take your time. Um, and in some strange way, I think this COVID thing that we're still living through, that doesn't want to go away, has perhaps been a little bit helpful in that it's given us some distance. Because you really shouldn't be hanging out with strangers, certainly not unmasked, and certainly now in the time that we have these fantastic vaccines, unvaccinated as well. And most of all, have forgiveness for yourself, for a potential partner. I always tell the story of, I had a male patient. He'd had prostate cancer, so he had he was not able to have erections, and he'd been married for many, many years, and his wife had died quite unexpectedly and suddenly of a heart attack. And this poor man was so lonely and so emotionally needy that within a couple of months of losing his wife, he started dating online. Things did not go well, I have to tell you. And he used to come and sit in my office and just weep. I felt so badly for this poor man. One day he came and he said to me, "Do you know how many women like hunting and fishing?" It took me aback a little while. I'm thinking, I don't know a single woman who likes hunting and fishing. But this is what women of a certain age were putting on their profiles on these dating sites, because they thought this would attract men. You got to be honest. Put down what your interests are, because that's how you're going to meet like-minded people. And remember, everybody has baggage. If you are in your 30s, I'm not sure you want to be dating somebody in their early 20s, particularly a man in his early 20s, because, man, they're just unformed, right? And you're going to have to do a whole lot of training to get that guy into some kind of shape that's acceptable. If you're in your 40s, 50s, or 60s or 70s, you're probably going to want somebody who's got a little bit of life experience under their belt, and they have baggage. Right? A man or a woman who has lost their partner is going to go into a new relationship being really scared, just as you are frightened. So some forgiveness really does go a long way. Okay. Questions. Firstly, here, please write down my email address, which is not there. So my email address is drannekatz@gmail.com. I do not